Let's talk about birth plans. Can you plan the unplannable? And why would you even want to try? Today we're going to talk about it. I'm Hillary, I am the pregnancy nurse, and I'm the curly head behind the website Pulling Curls, where I aim to prepare you from bump to bassinet for your upcoming confident collaborative delivery. I have been a nurse since 1997, and I actually have 20 years of labor and delivery experience. I have seen a lot of birth plans, and in fact, I've made some of my own because I have 3 of my own children. So today we're gonna dive into why you should make a birth plan. We're gonna have another video coming up where we're gonna talk about what to put on your birth plan, but before I get started, I actually have a free birth plan series that you can sign up through the link down below. It is called my free birth prep pack, and you can get prepared with a free birth plan printable and a sheet about like making the choices on the birth plan. And I also have a video where I talk to you about your mindset about preparing for your delivery as well. Before we get started, be sure and like this video and subscribe while you're down there so you can tell YouTube you are interested in preparing for your upcoming delivery. Now, a birth plan's pure and simple is just your plan for your birth, what you would like to have happen when you give birth. Beyond that, it does things for you, and it also does things for the healthcare staff. So we're going to talk about you in a second, but first, what does it do for your health providers? First off, it helps us know what you want. And in knowing that, first off, we don't have to ask you quite as many questions as we go through our questionnaire, because a lot of those questions might be on your birth plan already. Are you planning on an epidural? Do you plan on breastfeeding? Things like, do you want a pacifier? You might also include on your birth plan who your pediatrician is. So a lot of that can already be included on the birth plan. And then I don't have to ask you as many questions during your hospital admission. There are 5 million questions. I'm not even kidding. Lots of questions. So it does simplify that a little bit as well. Also, it just gives us kind of a general idea of what you're hoping for. It kind of gives us an idea of who you are and what you're hoping for. Honestly, most birth plans are all the same. You don't want a C-section. You would prefer not to use Pitocin. You prefer not to have an episiotomy. All of those things are the same, and honestly, that's what we want for you too. Those are all complications that we would prefer not to do. So for the hospital staff, it just gives us kind of an indicator of what you're planning on. Now for you, it does something different. It really helps you to start thinking about what you would like to have happen at your delivery. Now, I am a huge fan of that. That's what I'm here for on all of the different social media, is helping parents prepare for their hospital delivery. And in order for you to do that effectively, you really need to think about all the different choices that you're gonna have. And a lot of your birth plan is going to include the baby, and that is a point where you invite your partner in so that you guys can talk about what you want done with a baby. Of course, there's those portions that are a lot about the birther and who they want in the delivery room and how they want their body treated during labor, and that's really up to the birther. The second part is more about baby and what baby wants and needs after delivery as well, breastfeeding, all those different kinds of things. So by coming together as a couple, you can be a little bit more prepared for your birth and also just start to make those choices together, because this is just the beginning of making lots of different choices for you and your baby. Now, what does a birth plan not do? This is not exactly what we're going to do in your labor. Things might happen. I mean, the real birth plan is created by Mother Nature, but she does not print it off and give it to you. She makes up her own mind, and things change while you're in labor. And so I got in big trouble on TikTok by saying that I never just followed someone's birth plan, and everyone was like, you should just follow the birth plan. And that is not the case at all. Of course, along the way, I'm going to ask you if these are still the things you want. If you're not feeling well right after delivery, it might not be the best time to breastfeed, even if that is on your birth plan. Or you might think that you want an epidural, but you end up going natural, and that is a choice that you can make while you're in labor. The vice versa can also be that you might think you're gonna go natural and you end up getting an epidural, and I've seen all of those things happen so many times. I don't just do what's on your birth plan. All along the way, I'm asking you what you want so that you can tell me and make the choices during your delivery. The birth plan is just that you've thought about it, and if things go according to the plan that's in your brain, these are the things that you would want to have happen. They are great. I don't want to dismiss it, but I also want you to understand that you have to be flexible, because who knows what's going to happen when you're in labor. And the best part is that you've researched this and you've really thought things out so that you can make the best choice when you actually have it happen. So that's birth plans. I'm going to have a whole nother one coming up about the different things you can put on the birth plan. But for now, check out that free birth prep pack down below, and I would love to see you guys inside of that. If you like this video, go ahead and give it a thumbs up and subscribe while you're down there. And I think you're going to like these upcoming videos as well.